So looking across the various versions, starting out with HIIN 1.0, as Mary Ellen talked, HSAG was an evaluation contractor, and that's important because it really gives you a deep understanding of this work. Across the program, you can see there's been continued focus on hospital-acquired infections, readmissions, adverse drug events, with also additional topics coming in as patient and family engagement, high reliability, opioid safety. And now with the HQIC, we are adding other topics such as emergency response planning, which includes pandemic preparedness for COVID, diagnostic air, and airway safety. The other thing that is really unique about this version of the hospital quality project from CMS is there is a very significant focus on small and rural and critical access hospitals. And then there's also a carve out for those serving vulnerable populations and hospitals, regardless of the size, that have been 2 stars for 4 consecutive years. So there's a little bit of a shift, and I think it's a good thing, and I think it really allows us the opportunity to be innovative with our approaches. So I wanted to take a minute because there's a lot of entities, and you hear us talking about QINQIOs and HQICs and BFCCs, and sometimes it's hard to keep all these CMS quality contractors clear. So I'll start with the QINQIO. HSAG is currently the QINQIO for California and Arizona. And even in the states where we may not be the QINQIO, it is important to know that because we have that inside knowledge and function as the QINQIO, we understand that work that will allow us to better collaborate and align and reduce duplication. Now, we also have, of course, relationships with the other QIOs as we work in collaboration. The key thing about the QIOs, because you'll notice some overlap, and we get a lot of questions about, well, we're already working with the QIO on readmissions or, opioids. What you need to remember is the QIO's focus is on the community level. So it's really pulling the entities together in the community, which does include hospitals, but it's without, in the outside 4 walls of the hospital. The BFCC QIO, which is Beneficiary and Family-Centered Care Quality Improvement Organization, that's Kipro and Levanta, and they're the ones that field the quality of care complaints and appeals. Those are the letters you get if a beneficiary has an issue or an appeal. The next entity we call the VICR, Value Incentives and Quality Reporting Support Contractors, and those are the folks that support value-based purchasing, inpatient quality reporting, outpatient quality reporting. And HSAG currently holds that contract, and that's important because it allows us to be very nimble and within our organization have subject matter experts that can be called upon to provide support to our hospitals that are participating in HQIC, if there's questions that align with what we're doing. And then last and most recent is the HQIC, which is really, as I said, focusing on the quality improvement processes and procedures within the 4 walls of the hospital. Although we can't work in a silo, that's our primary focus, and then engaging with the other entities. And with this slide, and it kind of expands this out a little bit more, and we have the hospital in the center. We really should probably have the patient and family, but for our purposes, the hospital is our center, our focus. The HQIC is working within the hospital. And then you have your hospital associations, offices of rural health, and QIOs that are working on a more community level. And it's our role to really work together and collaborate together to ensure it's seamless for our HQIC participants. So there's not redundancy, and we're really providing you with the best tools and resources to support you and not be added burden or one more thing to do. So looking at this alignment and really not wanting to add any additional work for our hospitals, I just wanted to point out, for the critical access hospitals that are focusing on MBQIP, there are a lot of alignments so that we can expand the support and the improvement in these areas. For example, antibiotic stewardship overlaps with antibiotic stewardship initiatives in the HQIC. HCAPs, a very strong driver of those outcomes, focus on patient and family engagement. So we have a lot of integrated improvement efforts that infuse patient and family engagement into each of the topic areas. And we have the knowledge and the experience helping hospitals build a strong patient and family engagement program. And then when you look at the communication and transfers and throughput that truly is care transitions, making sure we are prepared as we discharge our patients, whether it be from emergency departments or an admission, as we discharge them into the community. And then some of the alternative measures with MBQIP are your HAI, healthcare-associated infections. And we understand a large majority of critical access hospitals do not really see a lot of central line infections, surgical site infections. So while we do provide in-depth one-on-one support for the key hospital-associated infections, our focus is really to work with you and provide a strong infection control infrastructure that will ensure you are keeping your patients safe, whether it's from CAUTI or COVID. So, and Eli is serving as our subject matter expert for that. Falls, adverse drug events, that continues. We see that across the board with the hospital quality programs. It's really focusing on opioids, and not just the opioids outside in the community, but really looking to make sure you have good monitoring processes and looking at prescribing at discharge. And then culture of safety. So really looking to make sure we have an infrastructure built to help hospitals be able to give safe, high-quality care. So for the acute care hospitals, a lot of the focus is on value-based purchasing, and these are the most updated domain weights. And so we're going to take a closer look at this to see how working with HSAG HQIC can help improve your value-based purchasing. So the first is the safety domain, and again, it involves HAI. And, we will address that by helping you build a quality infrastructure surrounding infection prevention. And the next one is the PSI 90. Now, that went away for a little while, but it is back into value-based purchasing, and it's focusing on a composite of the patient safety adverse events. So for the HQIC, there's alignment with pressure ulcers, falls, respiratory failure, DVT, post-op sepsis, wound dehiscence, which, can obviously be a risk factor then for later surgical site infections. So we will provide support in all of these areas. And person and community engagement, which is your HCAPs. And, we've talked before about how HSAG has subject matter experts and has really designed programs to integrate patient and family engagement so that you're really providing patient-centric care across the board on all of the measures. And then clinical care domain. So, this really focuses on patient safety as a whole, and as well as care transitions. Your 30-day mortalities sometimes are a good balance measure to look at as you're working to reduce readmissions, making sure we're not discharging patients too soon. It kind of all ties together. And I'm working with our analytics department because I know it's very hard to monitor those 30-day mortalities. You really only know who has expired by if they expired in your hospital. So you don't really see the mortalities if they were discharged and died at home or at another facility. The claims measures that we have, just like we do for readmissions, is again based on claims data, so we can really see at the level of the patient and be able to give you your readmission measures as well as your mortality measures, that before you get those reports from CMS. And efficiency and cost reduction, or your Medicare spending per beneficiary, that really ties back to care transitions and really knowing where your patients are being readmitted from, and what you can do to make sure they're better prepared to be discharged, that your partners and community, such as your nursing homes and home health, are all collaborating together to make sure you have seamless transition to care. So this slide, we just really wanted to take a minute, as Dr. Dalton, our CEO, mentioned. HSAG was ranked #1 across all the HIINs in the CMS program, and based on the performance goals. And it truly was a dynamic team that HSAG had, but more importantly, the effort that the hospitals, the participating hospitals, taking the initiative, utilizing the tools and resources and knowledge that we shared with them that worked best in their facilities. And again, we avoided 25,000 harms and nearly 3,000 lives saved. Really was very impressive. We had a huge decrease in Clostridium difficile. I think it ended up being like a 53% RIR.